The science, clear, factual, and powerful. Osteoarthritis is more than wear and tear. Osteoarthritis, OA, is one of the most common chronic diseases in aging dogs and cats. But it's not just cartilage wearing down. It's a complex, progressive disease involving loss of articular cartilage, microfractures in subchondral bone, inflammation of synovium, remodeling of bone structure, increased nerve growth within the joint, and at the center of the pain process, nerve growth factor, NGF, the NGF pathway, the main pain highway. NGF is a signaling protein that binds primarily to TRPA, receptors on sensory nerve endings. When this happens, 1. Pain signals are transmitted to the spinal cord. 2. Nerve fibers proliferate in damaged joint tissue. 3. Pain sensitivity increases. 4. The joint becomes progressively more sensitive over time. As osteoarthritis advances, NGF levels rise. More NGF gives more nerve growth, gives more pain signaling. This is why arthritis pain often worsens over time. How Librela and Solensia work. Librela, dogs. Solensia, cats. These are monoclonal antibodies designed to bind NGF in circulation and prevent it from activating its receptors. No NGF binding gives reduced activation of TRPA receptors, gives reduced pain transmission. For many pets, the results are dramatic pain relief. But here's where the story becomes more complex. The overlooked side of NGF, those same sensory nerves that transmit pain, do something else. They release protective and regenerative factors directly into the joint. NGF signaling through TRKA promotes bone remodeling, supports fracture healing, enhances cartilage matrix production, encourages tissue repair. This isn't speculation. It's supported by published research. Not just a pain in the bone. Sensory nerve growth factors promote fracture healing. NGF receptor signaling limits inflammation and promotes remodeling. Nature communications. Fracture repair requires TRPA signaling. Local beaten GF delivery accelerates fracture repair. NGF improves chondrocyte, extracellular matrix synthesis via PI3K-AKT signaling. These studies show NGF plays a role in repair and maintenance, not just pain. 2 receptors. 2 systems. NGF binds to 1. TRPA receptors, pain transmission plus repair signaling. 2. P75NTR receptors, local anti-inflammatory and protective pathways. Anti-NGF monoclonal antibodies do not selectively block only the pain signal. They block NGF's interaction with both receptors. That means pain pathways are suppressed. Protective neural pathways may also be suppressed. Local anti-inflammatory and remodeling signals may be reduced. Theoretical risk: reduced protective signaling could, in some patients, contribute to accelerated joint damage. What happened in humans? A human anti-NGF drug called tanezumab was developed for osteoarthritis pain. It was highly effective for pain relief, but during clinical trials, some patients developed rapidly progressive osteoarthritis, RPOA. This is a catastrophic, accelerated breakdown of joint structures. Because of this safety concern, tanezumab was not approved for human use. Has this happened in pets? Veterinary pharmacovigilance reports and case observations have described joint deterioration patterns in some dogs and cats treated with anti-NGF therapy that resemble rapidly progressive OA. Important context: This does not appear common. Many pets benefit significantly, but biologically the mechanism is plausible. Blocking NGF blocks more than pain. What the literature shows. An extensive review of current research reveals 10 major anabolic protective joint signaling pathways promoted by NGF, 2 catabolic destructive pathways that NGF inhibits. In other words, NGF appears to favor joint repair more often than destruction. This is why complete pathway blockade deserves careful, evidence-based evaluation. The core question, is NGF purely a villain in osteoarthritis? Or is it a dual-role molecule, one that causes pain while simultaneously attempting repair? Pain suppression and tissue biology are not always aligned. Relieving symptoms does not always mean improving structure. What this means for pet owners. This is not a call for panic. It is a call for informed decision-making. If your pet is receiving Librela Solensia, ask, is my pet being monitored for structural joint changes? Are we combining therapy with joint protective strategies? What is the long-term plan? Pain control matters, but so does joint integrity.